Hello, it's John Gonzalez from the Dizziness Balancing Concussion Centre, and today we're going to be looking at a brief guide to the causes, symptoms and misconceptions around concussion. So it should hopefully blow some of those myths out of the water, maybe give you an idea of what's right, what's wrong regarding concussion. As always, there's a disclaimer with these things. This isn't a substitute for actual medical attention. If you've got any doubts whatsoever, please go and seek a medical professional who knows about concussion. Don't take chances, please. Also, the information in the following slides is as up to date as I can make it with what we know today. However, some people believe otherwise. Mine's based on the literature and the research, but also things are changing extremely fast as well. So depending on when you watch this or read this, it may have changed by then, or it might be tweaked a little bit, this and the other, because there's research happening all the time. And obviously, with respect to all of this, we can accept no liability to the content of this presentation. So, just very briefly, what is concussion? Concussion is a result of a force being transmitted through the brain. It can happen through a bang on the head, which is generally most common, but also it can just be through shock and forces through the body, which then have travelled up into the brain and made the brain move sufficiently. What happens is that you get a stretching and shearing of the nerves. So if you imagine the brain very simply as two layers of jelly, one very thick and tough or tougher and one very sloshy, if you shook them around they'd move at different speeds, and where they join you'd get this shearing and stretching. Now if you imagine a nerve going across there, that would be stretched, that would be sheared back and forth. If you put that all into a 3D picture in your mind, that's what's happening with a concussion, and it forces the nerves to do things that we wouldn't like them to be doing at that time. And it causes them to function incorrectly, and it is a functional problem. And we'll come on to that in a second rather than a structural problem, but I'll explain that in a second. Most common in sports, car accidents, workplace injuries. But if you have a fall, you have a trip, you crack your head hard enough, or you turn and you're twisting and you get hit or something like that, it can happen anytime those forces are transmitted. So you do hear some weird and wonderful stories doing this job. They are out there, so just be aware of that. So the symptoms of concussion. This is a pretty comprehensive list, but it's not limited to. Everyone responds in different ways. People will have some of them, all of them. That's rare. But some people might have one or two. Some people might have a few more. Some might have ones which really dominate, and then the other ones are in the background. A few just to pick out there: that obviously the headache, the sensitivity to light and things are quite common. The feeling in a fog is a very common one as well, and difficulty remembering or concentrating and things like this. But other ones, the trouble falling asleep, a lot of people think it's the other way, which generally it is, but there are people who respond and they can't get to sleep, they really struggle. The nervousness and the anxiety and things like that, and sadness can potentially be a problem as well. So it's just good to have a good idea of what a concussion can cause. And as it says there, and we'll come on to this, and this is one of the biggest things, is that only because your symptoms have resolved does not mean you have recovered from your concussion, does not mean that you're better, unfortunately. We think, or generally for a lot of people, symptoms can resolve in 2 to 3 days. Some people it can be significantly longer, but the actual brain takes, for most people, in a simple progression and a simple recovery, about 30 odd days we believe. So there's a big mismatch there. You can feel okay, but that doesn't mean your brain's back to work in order, so just really do bear that in mind. So some of the common misconceptions. The first one, a lot of people still don't think concussion is serious. This is changing, thankfully, but it's a very dangerous attitude to take. It is potentially deadly, unfortunately, and not the initial concussion, we don't think. The key is if you get another hit on the head before your concussion has recovered and before the neurons and the nerves and the brain have got their energy levels back up, that is when you could potentially have brain damage or death. And that's something called secondary impact syndrome, and it's something that we need to be very, very vigilant about, and we need to manage very carefully because it is that serious. Another big one, that a lot of people still think that you have to be knocked out to have a concussion, whereas actually the research shows that over 90% of people take the bang on the head, they are not knocked out, they do not lose consciousness, and they've got the concussion. So it's a lot more common to not lose consciousness rather than to lose consciousness. Now, if you do ever get knocked out, you've got a concussion as well. It's as simple as that, and we need to manage that effectively. And depending when you come round, you might not have any symptoms. You might feel not as bad once kind of again that fogginess, that shock goes, but you've still got a concussion there. So do bear that in mind. Another one which is worrying, because this is a very common one, that a lot of people think you stick a helmet on, you stick a head guard on or a mouth guard, that'll stop people getting a concussion, or it will lessen the severity of concussions and things like that. Unfortunately not. Now, those are all very, very valuable pieces of protective equipment, and they're worn with reason, especially if they're well fitting. They should be worn, but they're not being worn to prevent or limit a concussion. And there is no evidence to support that, really. It shows it doesn't stop the forces going through into the brain. Now, they can stop other things, skull fractures, bad dental accidents, things like this, but not concussions. And they don't make a concussion less severe either. In fact, some of the research, and also if you just anecdotal evidence, that you stick a helmet on somebody, you stick a head guard or mouth guard in there, that people start playing with more aggression, more reckless. They don't look after the head as much because they think it's protected. Therefore, potentially, it could actually increase the chances of concussion because they're not being careful with with the head and with the brains and what they're doing. So do take caution there. The MRI and CT scans. So again, I get a lot of people saying, "Oh, well, I had an MRI, I had a CT, it didn't show anything." Well, it won't do, and that's good. We're happy. That means that you don't have a serious brain injury. However, in concussion, they can't be picked up on these scans, and there is no scan at present that definitively tells us whether we've got a concussion or not. They're doing a lot of research into that field, looking at different blood markers, looking at different scans, but there's nothing definitive and nothing reliable at present in the literature or in the research that says that yes, you've had a concussion or you've got a concussion. We don't have one. So again, don't be happy that you've got a clear scan. That's great. However, don't think that puts you in the clear regarding concussion, and doesn't mean that you can go back and return to sport either. So just do bear that in mind. So, some more misconceptions. As we've talked about, if you don't have a headache or any symptoms, all is good. As we've said, that only because your symptoms have gone, only because you're not feeling any of the symptoms anymore, that does not mean you've recovered by any way, shape or form. And you've got to really be careful with that. And this is especially so if you are at rest and you don't have a headache. Well, maybe when you start exercising, when you start putting more physical strain on your body, that the symptoms might appear then equally. But even so, even if that's not the case, we've got to be very careful because it's not one facet. We've got to check it against a few different things. So do be very, very careful with just saying, "Oh, my headache's gone away, I'm fine to play." No. Again, we're talking close to that 30-odd day mark, and that's not definitive, as I say, but around that 30-odd day mark for most people, that's when the brain will have recovered. But there are other ways that we can be a bit more sure, and we'll talk about those in the next few slides. One that still happens, people get a concussion and they straight away get the sunglasses on because they're sensitive to light. The lights go down, they sit in a dark room, things like this. Well, maybe for a day or two you might give into it a little bit, that sensitivity, but unless you've got a real severe sensitivity to the light, you need to avoid putting on sunglasses more than normal or having the room darker and things like this. Now, I'm not advocating going out and into bright sunshine and things like that. You've got to use a bit of common sense, but going too far the other way can actually make that sensitivity to light significantly worse and a lot harder to get rid of. So maybe for a day or two you'd take it easy, you'd wear them a bit more, but not all the time. And equally after that, we've got to get you back to just your normal use of sunglasses, the normal lighting and things like this as quickly as possible to stop it becoming a longer term issue. And the last one on this page is children don't get concussion, which is completely wrong. They've got a brain just like we have, just like adults have. They are just as prone, if not more prone to concussion. They can be more prone, and we don't fully know, but people believe that the maturing brain is more prone to a concussion. We certainly know that the control of their necks and the physical size of a child's head compared to their body is out of whack compared to an adult. We know they're more active, therefore that straight away gives them a higher risk of concussion. And we know they're not as well coordinated, they don't always have as much fear, and it might just not be themselves, but equally their peers that they're playing with. So that is a big misconception. Children get concussions just as much, if not more, than adults, and it needs to be taken seriously in children as well, because the damage is still there. They can still have the secondary impact syndrome, they can still get the brain damage, they can still potentially die from it as well. So care needs to be taken for children. We can't just think, oh, they bounce back up, they're ready to go. No, we've got to be careful with it, and we've got to manage it correctly and appropriately. So, some misconceptions about the recovery from concussion, and one which is still being touted by different doctors and things that I hear quite often, is that rest is the only treatment. You go away and you rest until everything settles down. Not at all. You might have some what they call relative rest for the first few days, so you might take it easy. You might not be doing any sort of taxing exercises or operating heavy machinery and things like this until you feel a little bit better after that initial trauma and insults. So a few days, what we call relative rest, taking it easier, but then you want to start gently getting back into the normal flow of things. Now again, you might still be easing off using the heavy machinery or cutting the hedges or doing some very important exam and things like this, just until you're even further down the line. But you're not going to sit yourself in a dark room, you're not going to go to bed and just lay in bed and things like this. We need to be engaging with the world, we need to be trying to get all our systems back to normal. So rest is not the best treatment. What we really need is getting back to normal, and if there are things and symptoms that are stopping that, then we need to see someone. We need to get help with it, and there's help in various forms as to what we do. So as we go on to the next point, so if we don't just rest, what do we do? Well, it depends what symptoms we find. And generally speaking, with concussion management, it's all about the assessment, figuring out where we've got the issues, and then we start to look at your neck, your vestibular function, your vision and ocular and eye exercises, your balance and things like this, and then we start to put it all together and tailor a program for you. And that's, people always say, oh, what can I do? Well, we've got to find out what's wrong with you first, then we can tell you what to do, and that's the key thing there. Now, the other thing you'll hear a lot about with concussion, and is becoming a lot more known about, is baseline testing, and in particular multimodal baseline testing. All that means multimodal is that you've got different facets to the test rather than it purely being a computer program. The multimodal and the multifaceted testing has been shown to be more effective and more accurate. But what this is a test that you do in the off season. So if you're a rugby player, an ice hockey player, or any player of sports where there is a chance of, or quite a high chance of, impact on the head and things like this, so in collision sports, but potentially things like soccer as well and football, because there's a quite high number of concussions in there because of players clashing, going up for a header and things like this. But in the off season, when we know that you don't have a concussion, you're just doing your normal basic training, we'd run you through a battery of tests, and we'd get a score for all of those. We'd keep that recorded. If you have the misfortune then in the season of suffering a concussion, we'd take you through the initial recovery, and then before we okay you to return to sport, we'd get you to the stage where you're close, and we'd stick you through some cardiovascular exercises, and then we would retest you. Now what we're looking for is for you to be back to your baseline test and baseline levels with all of these, and that's the key thing, and that is the most accurate and safest way we know at present for a safe return to sport, is when someone has satisfied their pre-season, pre-injury baseline testing results, and they're designed in such a way that you should be able to, even when you've been put through the paces cardiovascular wise. So that is the safest way, and I'd always recommend anybody who's doing any sort of sport, rugby, any sort of impact collision sport, American football, rugby, ice hockey, anything like that, roller hockey, that you get your pre-season test done just as you would do your pre-season training. Get that done every year, and then you've got something that we can refer back to, and it can pay off in time, that is for sure. So, just some of the key points briefly. You don't have to lose consciousness to be concussed. If in doubt, stop, get medical advice. A big one, only because the symptoms have stopped, that does not mean full recovery has taken place, and you need to get the full recovery to stop the potential secondary impact syndrome. And the safest way we know to say that you are safe to go back to sport, there are other ways, but this is the safest, is by comparison of multimodal baseline tests. So, thank you for listening. I hope that's been informative and helpful. If you need any sort of other information, you can always go to the website concussiontherapy.co.uk. Equally, you can always send me an email. I'll always try and help just at info@concussiontherapy.co.uk, or you can go on our partners' websites from completeconcussions.com, from Complete Concussion Management over in Canada. Thank you very much for your time, and I hope that's helped.